Thank you very much, Mr. President. I appreciate the opportunity to discuss the issue of taxes and jobs today as we focus on the critical legislation in front of us. I've introduced an amendment, it's actually a motion, to commit this bill back to the Finance Committee to help us to honor the President's pledge on taxes. As we've discussed now for more than a week, notwithstanding all of the claims that are being made about this legislation, one of the irrefutable facts is that it grows the government dramatically. If you take the first full 10 years of spending, not counting the first 4 years that are not included in the spending, in other words, they are delayed in order to make the numbers look better, if you count the first full 10 years of implementation of this bill, it will result in $2.5 trillion of new federal spending. It will grow the federal government by that much. And repeatedly, President Obama has told the American people that he will not allow them to be taxed, those who he describes as the middle class, to be taxed in order to pay for this huge new increase in federal spending. To use President Obama's own words, I can make a firm pledge. No family making less than $250,000 will see their taxes increase. Not your income taxes, not your payroll taxes, not your capital gains taxes, not any of your taxes. You will not see any of your taxes increase by one single dime. And yet, what does this bill do? It includes $493 billion of new taxes in just the first 10 years. If you use that full 10-year time frame, that time frame that starts after the 4 years of spending that have been suppressed in order to change the numbers in the calculations on the bill, the total number of taxes in that 10-year window is $1.2 trillion of new taxes. And the question is, do these taxes fall only on the wealthy, or do they fall on those squarely in the middle class? And the answer is the large majority of them fall on the middle class. In fact, the Joint Tax Committee has indicated that by 2019, individuals earning $50,000, between $50,000 and $200,000, would on average see a tax increase of $595. Families earning between $75,000 and $200,000 would, on average, see a tax increase of $670,000. Now, my colleague from Montana, the chairman of the Finance Committee, has argued that there's actually a net tax cut in the bill. How do we get to those numbers? Based on a Joint Committee on Taxation report, of the $394 billion that the government will spend on what are called tax credits, and that's the tax cut that my colleague is talking about, $288 billion of those $394 billion in credits will go to people who pay no taxes today. Now, if you think about it, how can it be a tax cut if the money is spent from the federal treasury and sent to, or to somebody on behalf of, a person who's not paying taxes in the first place? You can call it a subsidy. You can call it a credit if you would like to. I know the words used in the bill are a refundable tax credit, but the reality is it is nothing other than pure federal spending. And in fact, the Congressional Budget Office classifies this kind of benefit as government spending.
Well, Senator, you have a question?
I will yield on the senator's time.
That's fine.
Without objection.
You say all those are people who don't pay taxes. Don't most of those people pay a lot of taxes? Don't they pay payroll taxes? Most of them will work.
There is a payroll tax. There is.
And aren't there other taxes that people pay? You know, it could be a sales tax. It could be, there are all kinds of taxes that people pay. Particularly working people, a lot of taxes they pay.
Well, reclaiming my time, the fact is that although people do pay a lot of sales taxes, not federal sales taxes, by the way, and although people do pay a lot of other types of taxes, they'll pay penalties and fees. In fact, under this bill, they're going to be paying a lot more taxes. The reality is that I don't think that's what President Obama was talking about. When he made his pledge, in fact, I think his words, well, you will not see any of your taxes go up. And the bottom line here is, you can't say, well, if you offset this tax and you don't count the sales tax, or if you add in the sales tax to counteract it. That's not what the president was talking about. And once again, as Joint Tax has said, by 2019, individuals making between $50,000 and $200,000 on average would see a tax increase of $590 plus, and families between $75,000 and $200,000 would see a net increase on average of $670,000. Let's go to the next chart. And I know my colleague from Tennessee is here. If he'd like to step in any time, please feel free. I just have two other quick charts to show, and then I'll toss the floor to you, and you can inquire. I see you have I think a question brewing there. In the analysis that was done by the Joint Tax Committee, by 2019, these people whose taxes I've just described, who are squarely in the middle class, there will be at least 73 million American households. That's not individuals, that's households. 73 million American households earning below the $200,000 that will face a tax increase. And sometimes the proponents of this bill say, well, that doesn't net out the subsidies that we're providing to some of them. Well, if you net out the subsidies, and I don't think that's necessarily a valid argument, but if you do net out the subsidies, it's still at least 42 million American households that will see their taxes increase under this legislation. Now, how can that comply with the President's promise? And all the motion that I've brought does is say to recommit this bill to the Finance Committee and make the bill fit the President's pledge. The President pledged people in the middle class, which he defined as families making less than $250,000 or individuals making less than $200,000, would not see their taxes go up. And with that, I see my colleague from Tennessee is ready to join in with me, and I would ask if he has any comments or questions to raise.
Well, I thank the senator from Idaho. I mean, the point that you're making is if you're going to add $500 billion, I mean, this bill, as proposed, is paid for about half by Medicare cuts and about half by tax increases, and is paid for some by sending huge new bills to state governments. But I guess the point that you're making basically is that if we're going to add $500 billion in new taxes over 10 years, or much more than that when a bill's fully implemented, who's going to end up paying those taxes? It's not going to be insurance companies. It's not going to be medical device companies. It's going to be the people who, it's going to be us. Isn't that true? Don't you expect that most of the companies upon which the new taxes are imposed will pass those taxes along to the American people?
Yes, as a matter of fact, I, in my own mind, distinguish between taxes on the American people and fees that will be charged to companies and businesses in the private sector that are also being passed on to the American people. And all of those will occur. One interesting clarification or explanation here is with regard to this refundable tax credit that is talked about so often. It isn't actually refunded to the taxpayer, as I understand it, or to the individual who doesn't pay taxes but is receiving the credit. It's paid directly to the insurance company, as I understand it. And so even though some people could be claimed to be paying less taxes by this argument, because some of those who receive the subsidy will get a greater subsidy than they will a tax increase. The fact is, even they still get a tax increase, and even they still pay their taxes at the higher level. It's just that some of them will get a subsidy that will help to offset that.
I wonder, too, if I may take a minute to talk about another form of taxes, which would be state taxes. Now, people might be thinking, well, you're talking about a federal health care bill. How do you get state taxes in here? Well, let me try to explain that just a little bit. I remember as governor some years ago of Tennessee, nothing used to make me madder than Washington politicians who'd come up with a big idea, take credit for it, hold a press conference and announce it, call it, for example, historic, and then send a bill to me, the governor, to pay. And then usually those same politicians would come back to Tennessee and they'd make a big speech about local control at the Jefferson Day dinner or the Jackson Day dinner. In fact, sometimes Republicans were just as bad as Democrats in doing it. I also remember that in 1994, there was a political revolution in the country. This body switched dramatically to the Republican side, and one of the main arguments was no more unfunded mandates. In other words, don't be coming up with big ideas in Washington and sending the bill to the governor or the state legislator or to the mayor or to the county commission and expect them to raise property taxes or cut services or raise college tuitions to make it up. So what I want to say today is this, that this bill already includes a huge new bill for the state governments. As it's now written, as Medicaid for low-income Americans is expanded after a few years, there's a big bill to the states. Our governor, who is a Democrat, by the way, has been very effective in pointing out this would add about $700 million over 5 years to our state. There is no way that our state can pay this bill without a tax increase of significant size or seriously damaging higher education or seeing college tuitions to begin to go through the roof, just like you saw them do in California the other day when they went up 32%. Why'd they go up? Because the state is having to spend so much of its money on health care bills, many of which are required by the federal regulations of Medicaid. Now, there is a rumor going around that there's a big deal cut last night that would pave the way for passage of this bill that says that instead of a new government-run program, we'll simply expand two of the government-run programs we already have, Medicare for seniors and Medicaid for low-income Americans. And I would ask these questions. I mean, first with Medicare, I mean, how in the world can we take $1 trillion out of Medicare when the program is fully implemented and give 34 or 35 million more Americans a chance to opt in it at a time when the trustees of Medicare have said it's going broke in 5 years? And so far as Medicaid goes, if it is true that the idea is to expand Medicaid to 150% of the poverty level, and of course, we're not invited to any of the meetings. They're all written in the back room. We don't know the details. But if it's true we're going to expand Medicaid even more, our governor has said in our state that doubles the cost of it to our state after 3 or 4 years. And so down the road in about 4 years, what we're going to see in Tennessee is a new state income tax or seriously damaging higher education. And I think it's a blow to public higher education.
President, would Senator yield on that point?
Yes, I'd be delighted to on your time.
I'm fine on my time. I like to quote from a letter just to refute basically the allegation that this is a big obligation on states. I mean, that's just totally not true. The question is it not true that on page 7 of the letter from the Congressional Budget Office, dated November 18, to Senator Reid, that CBO says that the CBO estimates that state spending on Medicaid would increase. It says $25 billion over 10 years. As a result of this legislation, that's $2.5 billion a year on average for all states. Another figure I know is about state increase would be not huge, be about 1.89% increase over state obligation. Why? Because, does this senator also know that because in the expansion population under Medicaid, the feds are paying virtually all of it, and part of that is because in the first years, the centers get a net increase because of the Medicaid drug rebate, but on a net basis, it's a 1.89% only increase in state obligation over 10 years. Does the senator know that not to be true?
Mr. President, my understanding of the proposal by the Finance Committee bill and by the Reid bill is that the federal government expands Medicaid and pays for 100% of it for a few years, but after that, the state has a significant portion of the bill. Am I not correct in that? While keeping
with both sides, it is a colloquy, so we have to divide this time up. The division, that's correct, but we're only talking about...
No, I'm not going to divide the time up, Mr. President.
Well, I have the floor. You're asking a rhetorical question, or is that an actual question?
Mr. President, I'll retain the floor, and I'll make the statement, and the senator can make his statement later then. But the fact of the matter is that after 3 or 4 years, the federal government sends a big bill to the states. The fact of the matter is that the governor of Tennessee, who is a Democrat, and who has worked with other governors and is actually leading the National Governors Association effort to see the impact of this kind of legislation on the state, says it will cost our state $700 billion over 5 years and $1.4 billion if we go up to 150%, and the state pays that part of the bill, Mr. President. And that means a big state tax increase. It means big higher education increases, and I guarantee, as a former governor, that if this happens, that 4 years from now, there will be a revolt in the states, and people will be asking, who did this? And in fact, I would say seriously that any senator who votes to expand Medicaid and send a significant part of the bill to the states ought to be sentenced to go home and be governor and try to govern the state under those conditions. I think this kind of legislation, and especially the rumor that I've heard about such a dramatic increase in the expansion of Medicaid, will be a damaging blow to American public higher education from which it will never recover. And that tuitions will go to a level where only the rich can of public higher education will be left aside, all because Washington politicians ran up the bill, took the credit, made an announcement, and sent a huge bill to state governments who are struggling with their worst fiscal condition since the Great Depression.
Colleague from Tennessee for that perspective, because we see state taxes as well as federal taxes will be going up. And I noticed that our colleague Senator Johanns has joined us as well. And before I ask Senator Johanns to join in with his concerns and questions and comments, I just want to make one other clarification here. Again, we have the President's pledge up here, and remember, the motion that I have made simply says let's make the bill comply with the President's pledge. If there are no new taxes, then the bill doesn't have to be changed if we pass this motion. If there are, it does. But remember, I don't think when the President made this pledge that he was saying that he will not increase taxes on a net basis. In other words, I didn't hear the President say, I won't raise your taxes higher than I cut them in some other area. He specifically didn't say that he would count subsidies being paid out to those who do not pay income taxes as an offset to any tax increases that he wanted to raise somewhere else. The President didn't get into all these nuances. The fact is the President said he was not going to raise taxes on the middle class. The fact is that the middle class is going to see very huge tax increases under this bill. Before I toss the floor to my colleague, I just comment that CBO estimates that only 7% of all Americans will receive any of these subsidies. And yet, specifically out of the 282 million Americans with some type of health insurance, only 19 million of them would be eligible for the tax credit and for their health insurance. And the rest of the millions of Americans are going to be the ones who are paying those taxes. If we can take this chart down now, that's how it ends up. That at minimum, and we're still going through the bill, and this number is growing, at minimum, at least 42 million people who make less than $200,000 and frankly far less than $200,000 are going to be paying a lot more taxes. That's the reason for the motion. And I would now yield to my colleague, Senator Johanns.
President. Senator from Nebraska.
The Senator Alexander really has this right. I had the honor of being the governor of the state of Nebraska for 6 years. And the whole idea of balancing the budget is not theoretical to a governor. You got to do it. And let me tell you, if I might, about our state. Many, many years ago, decades and decades ago, when our founders wrote our state constitution, they were worried about the state getting itself embroiled in too much debt. And so they said the politicians will be allowed to borrow some money. The limit they put in the state constitution was $50,000. $50,000. So you see, in Nebraska, when you're faced with a unfunded mandate like what's happening in this health care bill, I say you get three choices. You can cut programs like K through 12 education, higher education, much needed services. Number two, you can raise taxes, sales and income tax. It's about what you're down to, because that's really where the revenue comes from for states. Or the third choice is you get to do both. And I will guarantee to you that none of those approaches are very popular. So just within the last few weeks, our governor, dealing with the recession like every governor in the country, stepped in front of the unicameral like I did many times as governor, and he said, my friends, we have to cut the spending. Just as clear as can be, he said, we've got to cut the spending. People are hurting. They're laid off. They're not earning as much. They're not spending as much. Therefore, our revenues are down. We've got to cut the spending. And they worked over a couple-week period of time, and you know what? They came up with a plan, I think it was unanimously approved, to cut the spending. Well, now, here we are in Washington, and when you pull the gimmicks out of this bill and actually score it realistically over 10 years, this is a multi-million-dollar hit to every state, including the state of Nebraska. And so what are we handing off to the state? We're saying, guess what? You get a chance here to raise taxes. Not because of any vote you took on the floor of the unicameral in Nebraska, but because of what happened in Washington in unfunded federal mandate. And that's what this bill is all about when you look at the expansion of Medicaid. I read the reports to Senator Alexander about the possibility that this might go to 150%. Well, just keep doing the math, keep loading the unfunded mandates on our state governors. And you know why we're doing this? We're doing it to try to convince the American people that this is a cheaper bill than it is. But when they figure out that the governor of their state has this problem to deal with, and they come to figure out that they're going to pay higher taxes or get less services and education, it will become very, very real to them. I've said many times on this floor, with this bill, reality will set in. And here's another piece of reality. And then you look at the overall bill, about $500 billion in addition to this Medicaid mess that we're going to push onto the states, about $500 billion in new taxes. And Senator Crapo, you put up the promise that the president has made. Well, gee, when you're done with that board, we can ceremoniously tear it up. Because you know what? That promise isn't anywhere near being kept. When he said those things, quite honestly, there was no way he could deliver with this health care bill. Uninsured Americans get taxed. Insured Americans get taxed. Families with high-value plans get taxed. High health cost families get taxed. Flexible spending accounts get reduced. Small businesses get taxed. And we can go on and on and on to the tune of $500 billion. And that's not even counting the unfunded mandate hammer that we're sending to every governor in this nation.
Thank you. And I might add just a statistic that I was reading here while my colleagues were commenting. If you take out that CBO report, which is what actually analyzes on a nonpartisan basis the impact of these Medicaid expenditures, not including the proposed increase that we heard about overnight, it clearly says, and I'm reading from the report, that CBO estimates that state spending on Medicaid would increase by about $25 billion over the 2010 to 2019 period as a result of the provisions affecting coverage in Table 3. That estimate reflects states' flexibility to make programmatic and other budgetary changes to Medicaid and CHIP. And so I think that's the statistic my colleague from Tennessee was looking for.
Senator from Idaho and from Nebraska, you know, it is true that in the legislation, the estimate is the federal government will pay about 100% of the increased expansion of Medicaid for 3 years, and that it will cover about 90% of the cost, which sounds like a lot. But we throw so much money around up here, we have completely lost any appreciation of what that amount of money costs at the state level. And in our state, our governor has said that the 133% increase is about $700 million over 5 years, and that is a big new tax or a big increase in college tuitions. If I may ask unanimous consent to put in the record an article from the Wall Street Journal on December 4th from the Dean and CEO of Johns Hopkins Medicine.
Without objection.
The Dean of Johns Hopkins Medicine, who in a very sympathetic column, which I won't read but a sentence or two of, describing the current health care bill, says even if only half these individuals seek Medicaid coverage, such a large expansion would likely have an excruciating impact on the state budget. And Maryland is not alone. According to a Kaiser Foundation survey conducted earlier this year, 3/4 of the states have expressed concern that expanding Medicaid could add to their fiscal woes. As Kaiser notes, 33 states cut or froze payment rates to those who deliver Medicaid patients. So what the proposal in the Reid bill is, maybe exacerbated by this deal we've been hearing about, is to shift millions more Americans, which 50% of doctors will see new patients in that program, and then send a huge bill to the states, which will damage higher education. I'd say the senator from Idaho, I remember after I was governor, I was driving down the street and I heard on the radio, the state of Tennessee has done a wonderful thing. It's going to double the number of children covered by Medicaid at the same amount of cost. And it was going through my mind, that'll never happen. And that program became the TennCare program, which has nearly bankrupted our state.
I would like to thank my colleagues for their comments. Could I inquire of the President how much time remains on our side?
6 minutes.
Thank you. I'll just make a couple of other quick comments here, and then I'll allow my colleagues from Nebraska and Tennessee to wrap up with their final comments. I wanted to just raise one additional issue. In the chart that I have here, we show what's going to happen with the IRS. Right now, the CBO estimate indicates that because the IRS is in charge of the implementation of so many of the mandates and other requirements in this bill, and because of the new taxes that are going to be enforced and collected against the American people, that there will need to be an expansion of the IRS. And the CBO report says that expansion could be as high as an additional $10 billion at the Internal Revenue Service. Now, if there's no new taxes in this bill, if there's no new mandates in this bill, if there's no increased role of the federal government in the management of the healthcare economy in this bill, then why do we need to have the size of the IRS, which is currently today a $12 billion institution? Why does it need to grow almost double, up to $22 billion? The point here, Mr. President, is that the motion that I have made is very simple and straightforward. We can argue back and forth about what the President said or whether this bill has tax cuts or tax increases in it or whether in a net result it does one thing or another. But the bottom line is that with regard to about 157 million Americans who get their health insurance through their employer by 2019, they're not going to be eligible for any of these tax credits that people are talking about. They're going to be paying increased taxes. All this motion does is to protect those 42 million people that we were talking about who are going to see their taxes go up. 42 million households who are going to see their taxes go up. And if the other side is right and that what we're talking about doesn't exist in the bill, then this motion should be harmless. Because all the motion says is to commit the bill to the Finance Committee and tell the Finance Committee to take out the taxes that impact the middle class. And I would ask if either of my colleagues from Nebraska or Tennessee would like to make any concluding remarks.
Let me just offer a thought or two, and Senator Crapo has really hit the nail on the head. If this isn't happening, if in fact the argument of the other side is accurate and this isn't happening and this is some kind of made-up sort of argument, then you're absolutely right. This motion will have no effect. So why wouldn't you support the motion? Why wouldn't you want the health care bill to reflect the promise of the President of the United States? Why wouldn't you stand in and say, look, it's a hard time out there. Unemployment is 10%. People are hurting. Unemployment, underemployment is 17.5%. This has been as tough a recession as we have seen in a long, long time, and it has hurt real people. Why wouldn't you want to stand up for them and say, man, we understand. We have heard you at our town hall meetings. We've heard you back home. We've heard you, and we're going to make sure that we're not going to add to your burden. I appreciate Senator Alexander putting in that article. I thought that was a tremendous article. Medicaid is chewing up state budgets. I managed one of those budgets. Keep in mind, this is an entitlement program. No deductibles, no co-pays, no premiums. If you qualify, you get it. And so there's no way really you can manage this budget. It is just exponentially growing. 40% of the docs don't take Medicaid patients. Why? Because they go broke on the reimbursement rate. Hospitals tell me all across the state of Nebraska we could not keep our doors open on the Medicaid reimbursement rate. And so what are we doing? We're adding millions of people to that problem. They'll have an access problem. State budgets will have a problem. They'll be in crisis, and our little hospitals are going to face the same crisis. It's the wrong policy, Mr. President. It's the wrong course of action. Let's start listening to the American people.
Senator Alexander.
Mr. President, how much time remains?
1.5 minutes.
Mr. President, day in and day out, Republicans have come to the floor and said, instead of a comprehensive 2,000-page approach, try to fix this massive health care system all at once in a way that raises taxes and premiums and makes Medicare cuts. Why don't we instead identify the goal of reducing costs of health care to individuals and to the government and take common sense steps toward that goal? We've suggested small business health care plans, which have been offered, scored by the CBO to save money and expand coverage. We have offered proposals to limit the number of junk lawsuits against doctors. There may be an argument about how much that saves, but there's no argument that that wouldn't drive down costs. We have suggested allowing competition across state lines, creating exchanges. There are efforts in wellness and prevention that we've made specific proposals concerning. And in terms of corralling waste, fraud, and abuse in Medicare, and then spending the savings on Medicare instead of a new program, that's the Republican agenda. Pick a goal, reducing health care costs, and move step by step toward that goal in a way that re-earns the trust of the American people, instead of a comprehensive 2,000-page bill filled with taxes, mandates, surprises, and a Washington takeover of health care. So there's a real choice here, Mr. President, and we regret the fact that we seem to be continuing to move on this track without the track that we're offering. We want to defeat what's proposed, not end the debate, change the debate toward reducing costs step by step. Thank the President. I yield the floor.